Let's talk about PFM preparation on the maxillary first molar, and we are performing on Typhodont Step 1. Axial preparation: measure the diameter of burr using periodontal probe. At tip, it is 1.5 millimeters. Then start with the buccal reduction. Place 2 vertical depth orientation grooves using flat-end diamond burr. Allow the burr to sink in completely. Reduce 1.2 millimeters to 1.5 millimeters for PFM. This prevents bulky crown and improves aesthetic. Connect the grooves always go in one direction. Leave the little bit of tooth structure in the middle. Unprepared. The reason for this is that it acts as a putty index and gives an idea how much we reduce. That's called T-shape prep. Step 2. Proximal preparation. Using thin tapered diamond burr. Go inter-proximally, but do not break the contact. Ensure smooth convergence from buccal to lingual. Maintain taper of 6 to 10 degrees total occlusal. Always remember over taper, loss of retention. Under taper, undercuts, crown won't seat. Step 3. Lingual reduction. Same thing as we did on buccal side. Make 3 grooves and connect them. Reduce 0.8 to 1.0 millimeters. Uniform. Step 4. Occlusion reduction. Occlusion reduction always follow the occlusal anatomy. Depth orientation grooves placed with a flat-end tapered burr. Start from center and sink the burr completely. Reduce 1.5 millimeters to 2 millimeters. On functional cusp, 1.5 to 2 millimeters and 1 to 1.5 on non-functional cusps. Maintain occlusal anatomy to preserve strength. Always point the burr towards the center and should follow the same angle which the cusp tip provides. Don't straight the burr. Always do one cusp tip at a time. Don't do buccal and lingual reduction at a time. Step 5. Functional cusp bevel. Take the adjacent tooth angle transfer to the preparation tooth to bevel functional cusp. Use a 2-plane reduction on buccal surface, gingival third and occlusal 2/3, to mimic natural tooth contour. Then round off the margins. On lingual side, just round off the margins because it's a non-functional cusp. Step 6. Surface refinement. Smooth all walls, avoid irregularities, they concentrate stresses. Round off sharp internal line angles, reduces risk of porcelain fracture. Clinical tip. always use a periodontal probe or reduction guide to confirm adequate axial clearance before final finishing.